This is an update for Walker Street Doctors patients for Thursday, the 22nd of July. I do want to talk about four things: COVID vaccinations, surprise, surprise, myocarditis, mask wearing, and our general practice receptionists. Sydney's now deep into a COVID Delta variant outbreak, with young people being treated with COVID in hospital and on ventilators. It's not the same as last year. It's very much worse and very much more contagious. With regards to vaccination, by rights, all of our patients over age 50 should be well and truly vaccinated by now, or have had at least one vaccination, and we're now in the final weeks of giving second doses of AstraZeneca vaccine. In September, we're going to reconsider whether we do Pfizer or not when sort of decent stock starts to arrive in the country, and we're not vaccinating at all with Pfizer at this time. Instead, we're leaving that up to the much larger hubs. So all of our patients aged 40 to 50 should well and truly have an appointment booked at one of the New South Wales hubs for their first or second vaccination. Above age 40, truly the only discussion that we'll be having with you about vaccination is, should you have a safe and effective vaccine, or did you really want to run the risk of getting the Delta variant and not end up on a ventilator? At present, honestly, the conversation is just no more nuanced than that. There's a couple of very rare exceptions. The first is, and I could count them on one hand, the number of patients in our practice who have multiple medication allergies. And I could count on two hands in our practice the number of people who have anticardiolipin or antiphospholipid antibody syndrome with thrombosis. And those sort of handful of people are really the only exceptions. If you're pregnant, so under 40 is where it gets a bit tricky. So if you're pregnant or breastfeeding, you should by rights be lining up for a Comirnaty Pfizer vaccine when you're eligible. If you're a young man aged 18 to 35, you should be aware of the small risk of myocarditis, so that's inflammation of the heart muscle, and pericarditis, inflammation of the lining of the heart, with the Pfizer vaccine and not with the AstraZeneca vaccine. The AZ vaccine is approved and it's recommended and it's available right now to anybody over 18 who wants it. So Walker Street Doctors has got stock. We've got about a couple of hundred vaccines sitting in our fridge waiting to be used. We've got appointments available to give them this week and next week, and our phone number is 9955 5566. So Walker Street Doctors is committed to your safety and our safety when you come into our surgery for vaccination. So specifically the steps that we take are, we're spacing our vaccination appointments 20 minutes apart to enable you to wait till 15 minutes after vaccination safely. 100% of our staff are 100% vaccinated, and our staff are undergoing regular asymptomatic surveillance testing. Social distancing is mandatory in our waiting room, and extra seating is available outside. And we disinfect every surface constantly, like we've all got OCD. Mask wearing is mandatory for all staff and all patients at all times. On the subject of mask wearing, we occasionally are receiving requests for mask exemption, and please know that wearing a mask is a condition of entry into our practice. So if you don't want to wear a mask, please don't come into our practice. You won't be allowed in. So it's been mandatory for greater than 12 months. It should be no surprise to anybody that mask wearing is mandatory. None of our doctors will be providing any patient with a mask exemption letter. Instead, they will be happy to spend time discussing the reasons why masks are mandatory and different brands of masks that you might prefer, that might be more comfortable. On the subject of general practice receptionists, my practice manager and 4 receptionists are truly the best of the best of the best. They've been coping with protocols for the last 18 months, and especially in the last 6 months, which are very complex, they're technical, they're nuanced, and they're rapidly evolving. If you think COVID is impacting you, multiply that by several times to work out how it's impacting general practice receptionists. Every time the Prime Minister or the Federal Health Minister uses the throwaway line, just go to your GP and have a conversation. The person impacted by the tidal wave that follows that is the humble and grossly undervalued general practice receptionist. And as a consequence of that, general practice receptionists around the country are resigning in droves. So the next time you're speaking with one of my receptionists, please show them your gratitude or kindness, or at the very least, show them respect. Our protocols are in place to keep our patients, our staff, and our community safe. You may not understand the reasons for them, but please know that every single thing that we do at Walker Street Doctors is very carefully considered. And I hope that update has been helpful.